Welcome back to Primetime News, and a special welcome once again to our viewers on onespotmedia.com.
So up first this evening, imagine being in hospital 5 to 10 years after being discharged. Well, it's the sad reality facing more than 300 people who now call Bellevue Hospital in Kingston home. But why? And what's the extent of the impact on the nation's only mental institution? Well, our reporter Shamela Pullen has been seeking answers, and she joins us live in studio. So the big story is about beds.
Yes, Archie. Well, as you know, some public health institutions, bed space is limited at Bellevue Hospital. So people who genuinely need help aren't able to get full treatment because of these social cases. Here's what I found out. Clothes hanging on a line, people relaxing, some socializing and eating. This scene could easily be mistaken for a setting in a residential community, but it's not. This is a Bellevue Hospital in Kingston where mentally challenged people are treated. However, these days it also serves as a home to some 300 patients who have been discharged from the facility but have nowhere to go. The hospital administrators would not allow us to speak to any of these persons on camera, but those whom I spoke with say they want to go home to their family. Maxine Harris is a medical social worker at the facility. She says persons have been in the system for as long as 10 years. Some even have died there. Getting them out of the system won't be easy for various reasons. She explains when relatives have been contacted, either they too have died, they have migrated, or they complain that they don't have the resources to care for them.
When you go out to do the social investigation for some of these patients, you have an address. You go there. When you go there, sometimes there's no home. A home was there, but it is down. Or you might find some elderly persons. Mentally ill people like to light fire, and they're always destroying their home.
These patients are between the ages 18 to 80. Some are deportees. But Ms. Harris says even when people are discharged, leaving the facility, it does not take long before they see them again.
We have a problem with non-compliance among the mentally ill. They don't take their medication and they continue to smoke. And even if they take their medication, they continue to smoke and the medication doesn't work.
Ms. Harris says part of the procedure when these patients are being released is to refer them to the nearest community mental health nurse for follow-up treatment. However, that does not seem to be working. But President of the Jamaica Psychiatric Association, Dr. Earl Wright, says despite the government's call for these patients to be in their communities, the resources to keep them there are not enough.
There's so much you can do, so much transportation that's available. So again, the call for more teams, more buses so that we can treat these people adequately.
Chairman of the facility, David Wan, says the plan is to divide the hospital into two sections, one for the housing of the patients and the other to treat them. However, he's unable to say when this will be done.